morning, Mrs. V. How are you doing this morning? All right, I got a doctor's order to put in a 14 French catheter for you today to help you void a little better. Do you have any allergies or anything that I need to know about? Latex, betadine? Perfect. Could you tell me your full name and your birth date? All right, well, let's just get started here then. Let me go ahead and wash my hands. Get some gloves on. To begin with, we're just gonna do a little peri-care, make sure everything's nice and clean before we get started. All right, I'm gonna expose you just a little bit here, might be a little chilly. All right, I'm just gonna clean her starting at the farthest away outer fold. Outside closest to me, inside farthest away, inside closest to me, and then right down the center. All right, we're gonna cover you up while I get all my stuff together here. I drop that into my linen, take off my gloves, wash my hands. All right. Get our kit open here. All right. Okay. All right. We're gonna have you just lift up your hips just a little bit for me so I can get that in there for you. All right, perfect. I'm gonna open this sterile one. Sit right here. Okay, take out my sterile gloves. I'm gonna throw this away because I don't need it. Alright, I'm gonna go ahead and set my specimen cup over here. I don't need it quite yet. Get my tray ready. Alright. Put my sticker over here. I would cover my cotton swabs with my betadine and get those saturated. Toss that. Put my lube in this smaller tray here. Get that all ready. All right, put our syringe over here. All right. And I take my cotton swabs. I clean the farthest, drop the closest to me outer one, inside, and right down the middle. All right, now since this is a female, we're gonna lube it 1 to 2 inches. For a male, we would do 5 to 7. All right, this might be a little uncomfortable for a second. Just bear down. We'll go as quickly as we can here. I'm going to insert 2 to 3 inches until we get urine, and then we'd advance it another inch or two. All right. and I'm going to inflate the balloon with the 10 milliliters here to keep it in place. All right. Now I'm going to take the bag and secure it to the side of the bed. All right. Secure this to her leg here. All right, then take off my gloves and clean up my area. Oh. Looks like my tape there is struggling. I'm going to keep my syringe for when I discontinue it here in a moment. I'm going to collect the urine specimen. Keep my cap upside down there. Oh, let me wash my hands again. Put on some new gloves. I put a paper towel or a Chex or something underneath here to keep it from dripping anything off the floor. Take an alcohol swab, clean off the port. Since I just put this catheter in, it would be okay to take a specimen. I'd open it up, get enough for the test that I needed, not touching the cup. I would label this with the patient's name, the room number, the date, the time. I would take another sterile or another alcohol wipe and clean that off. Take these off, wash my hands one more time. Got some clean gloves. We're gonna go ahead and get that Benadine off you. Get it all clean and dry. Just as I did the first time, I would start at the farthest outside, farthest towards me, inside, and inside closest to me, and then straight down the middle. Well, from inside to outside. All right, let's get you covered up, Mrs. V. How are you feeling? How's everything? Doing good? All right. And I would document in the file how she tolerated it. Was there any discomfort? The size of the catheter I used. What the urine looked like that was returned, and I think that should be it. Now we're going to discontinue the catheter. All right. Hello, Mrs. B. Tabitha again. We're going to go ahead and discontinue your catheter today. Could you give me your full name and your date of birth? Perfect. All right. Doesn't look like there's really any urine in the bag at all. All right, this should go pretty quickly for you. Oh, let's see. All right. I'm going to go ahead and take my syringe. I'm going to take back out the 10 milliliters of fluid that I put in before. All right. All right. Bear down is perfect. How you doing? We would do any perineal care that we needed to do at the time. Make sure she was all clean and dry. All right. Then we would once again document how well she did, if there's any pain, if there's any redness to this site or any discomfort. And I think that should be it.